It'll always be freedom. It'll always be freedom.
Welcome to Conversations in Anarchy. My name is Laura and I'm your host today. From 31st of May to 1st of June, Anarchapulco is presenting the NonConformist Series with 13 plus speakers present with their hands-on approach to challenges we meet in life today. So check it out on anarchapulco.com and grab your tickets there. But in the meantime, today with us, I have a medical doctor, researcher, and educator who has become widely known for challenging mainstream views on health and disease. And he is a strong voice in a freedom health movement. He's advocating natural healing, serenity, and understanding how our bodies really work. Welcome, Andrew Kaufman. Thank you so much for being with us today. How are you doing?
I'm doing great. Thanks for having me.
Last 4 years, while I have been working for Anarchapulco, I have seen you every single year, but I have never had the possibility to talk to you, really. So thank you so much that I have.
Well, now you could have come up and talked to me anytime.
Yes, but when I'm doing this family camp thing, it's just so busy,
Oh, yes.
Yes. So I also want to thank you for your work in all the years, and especially during the COVID times. I'm sure that myself, as many people out there, and also those that were and is coming to Anarchapulco, when this whole thing started, me and others, we felt like, oh my God, this is totally wrong. It doesn't feel right, and it's like everything that we are being demand to do feels like really, really not right. But many people, and me as well, we felt very alone in our feelings. And then, hearing you and your colleagues that were brave enough to stand up and speak out loud about laws from the medical perspective of you, then your voice was stronger. Because to me, for example, if I was talking to someone and they could just say, what do you know about this? You're not a doctor, So thank you so much for your work.
Well, you're very welcome.
And I want to ask you, what is bringing you back to Anarchapulco year after year?
Well, there are many factors. I mean, of course, it is a platform and a stage where I can speak the full truth without worrying about being censored or even, shocking the audience, because they are already quite awake about many things. And, secondly, I love coming and getting to know the other educators and speakers who, speak in sometimes also in the health space, but also in different areas, because there is a sense of community that develops in this space. Because, in our separate geographic areas where we live and in our day-to-day lives, most people are, still under the spell of the mainstream paradigm. And it's quite different coming to an event like Anarchapulco, where, everyone there is of a different mind and they're all in one place. So the energy and community, is fantastic. And those are the main things that keep me coming back.
Thank you. Yes, I have heard from several speakers exactly the thing, and also from the audience, that really coming there, you feel like, okay, here I can really openly talk about things, and not having to explain everything. But there is one thing that still is also among the people at Anarchapulco, for example. And this is something that you have been talking a lot about, and this is terrain theory. So could you explain in like simple terms what is terrain theory?
Yeah, well, actually, there really is no terrain theory. It's kind of a misnomer, and because I like to use the word theory for what it actually means. But terrain, medicine or terrain-based health, which would be a more accurate term, really encompasses several different theories about how biological organisms work, in health and disease. And we can talk about those specific theories, but overall, it's the idea that, your health comes from or is represented by the milieu which you live in, which includes, of course, inside your body, all of the fluids and matrices of tissue that hold all the biological elements together and support it, but also the terrain outside in the environment that you live in, that you spend time in, that you interact with. And that also is the source of all the building materials that come into your body, the air you breathe, the food you eat, the water, and other things that you drink. And even, of course, what comes in contact with your skin, because many things can enter our body through the skin, especially man-made substances, but even, various things from plants, if anyone's had poison ivy. So terrain medicine is really looking at all those factors and hypothesizing that the cause of health problems come from an unhealthy terrain in some way, whether it's inside your body or in the outer environment which you exist and spend your time.
So, and comparing it to the germ theory that we have been growing up, and it's still the theory that is facing us in the mainstream healthcare. So what's the main difference?
Well, yeah, so germ theory, by the way, which has been disproven in experiments, postulates that there are, practically invisible germs. You need high-powered microscopes to even see these things, and that they are, evil in some sense or parasitic, and they enter into our bodies and start eating us, essentially, and damaging our tissue and destroying our health. And many illnesses in mainstream medicine are explained as a result of this process, and many other ones that don't have a readily available explanation, the community generally points to an undiscovered germ as the cause of the problem, like, for example, with type 1 diabetes, even, which most people would think has nothing to do with germs. There is a theory that, of course, there's a virus that infects the pancreas and causes that in children, but there's no evidence to support that. So the corollaries of this germ theory are that, one, you can't control it because the germs are just out there and they decide when they enter your body, not you. So it takes away your ability to prevent or control it. And then secondly, you would really have to rely on the medical establishment in order to get treatment, because they're the only ones who know how to, quote unquote, kill these germs. Now, of course, none of those things are actually true in reality, because there aren't, there are microorganisms, of course, but none of them have been demonstrated in real scientific experiments to make any other organism sick. And when you kill those things, right, like bacteria, you're not just killing one type of bacteria, you're killing all of or most of the bacteria. And this is actually, widely known and published even in the mainstream literature with antibiotics, that they're not specific, for any particular strain, and they damage a whole bunch of bacteria. And the problem, there's many problems with this. of course, one thing is that we're just really talking about a poisonous chemical. That's what an antibiotic is, and it's even named for that because anti means against and biotic means life. So it's against life. Obviously, that would mean it is a poison. And what is missing, although the mainstream acknowledges the, quote unquote, importance of the microbiome, and there are scientific studies that have shown bacteria and other microorganisms in all parts of our body, not just in the gut and on the skin, but even in the brain, even the brains of healthy people. Okay. And what the reality is that these bacterial and other microorganism species are actually part of our body. And we know from other research that when they try to raise animals that are quote unquote sterile with no microorganisms, their health and survival suffers greatly because these things are actually part of us and they're not making us sick. They're actually required for us to be healthy.
I think Dawn Lester in her book, she's calling this like trying to kill the firefighter because there are so many around the fire, and and that's how probably the bacteria are viewed as that since they are there and doing something, they might
this is a very important analogy because while for many hundreds of years, there were theories about that there could be some agent in the air that makes people sick. And that actually can happen like after a volcanic eruption, for example, when there could be poisonous substances in the air that can make people sick. But it wasn't really until the invention of the microscope that there was anything, any suspicion or hypotheses developed about germs causing illness. And the primary observation that they had was when they looked at diseased tissue from animals under a microscope, they saw bacteria there. And that led to, the hypothesis or presumption that those bacteria actually caused the damage to the tissue. But they didn't have proof of that. They only had the presence of the bacteria. So that compares with if you look at fires, you don't need a microscope to see the fire. But if you just observe fires, you'll almost always see firefighters there. And so by the same logic, you could say, well, the firefighters must have started the fire. And obviously we know that's not the case. They're actually there to extinguish the fire. And just like the bacteria are there actually to clean up dead and damaged tissue and remove debris.
Yeah, but there is one thing. When I try to talk to friends or family or neighbors about, the germs, we don't really have to disinfect our hands all the time or do things like this because, it's not what makes us ill. And actually, we need them to be healthy. And then I always get this question, and we have experienced, of course, in our family that as well, that, for example, if our daughter goes to a neighbor friend, and then there's somebody is having what is called like stomach flu, then most probably everybody in our household gonna get it, and everybody in the neighbor's household gonna get it. And if we will manage to communicate or hang out with someone in the third family before we get ill, then the third family gonna get it. And it is experienced as very contagious. And
well, let me interrupt you there because how can you experience it as contagious?
Because they had it, we got it, and then it kind of goes around.
So I went to a dinner that was like a family reunion a number of years ago, and everyone who ate the same dish at the restaurant had vomiting and diarrhea that night. So were we contagious?
No, you were eating the same food.
Oh,
That was
all right. So how do
really
you
good.
know then, how do you know based on your observation that it was contagious?
I guess.
Let me ask you, did you
Just
observe
yeah.
germs from one person going into another person?
No.
Okay,
I
so how do you
didn't.
know that that took place?
I don't know.
Okay,
The
so
thing
this
that
is
I
this
know.
is a this is the fundamental problem with trying to talk to people about this topic. It's because, a couple of things. One is, of course, we all have been programmed since we were very, very young about that germs make us sick and contagion is a real thing, and we should avoid, contact with people who are sick as a result of that. And then throughout our life, based on that programming, whenever we observe people getting sick in similar ways around the same time, we just believe that that must be the reason because we were told that ever since we were young. But if we think about it more objectively and scientifically, we cannot make that observation without special equipment because we can't see germs. And we can't even detect that any fluids or tissue is being exchanged between us necessarily. So we just believe that without an actual observation. Now, the other part of this is that even if we were able to observe what happens to us individually or just the people around us very closely, we still we can't prove any causal relationship that way, because there could be other explanations. There could be a psychological effect, like a nocebo effect. Like, for example, when they had some cancer patients in a research experiment, and they told those patients that they were going to be getting chemotherapy, and they put an IV in, but they didn't actually give chemotherapy. They just gave salt water. Well, many of those patients lost their hair. And that's because they believed they were getting chemo, and they know chemo causes hair loss. And psychologically, even though they didn't get one drop of chemo, their body still lost its hair, right? So there are many, many factors that we can't know based on our own individual observations. So in order to understand these causal relationships, that's what the scientific method is for, because we need to have experiments where we can do two things, where we can have what they call an independent variable, which is we only change one thing so we can observe the effect of that one thing. And then we have what's called a control group where, or a control experiment where we take that one thing out of the equation and make sure we don't get the same effect. Because sometimes we could get the same effect caused by something else, and we didn't identify the cause, and that would tell us that what we think is the cause is wrong. And so we would have to do these kinds of experiments, and fortunately, they've been done. Now, some of them are difficult to obtain through the internet by the usual ways, but they can be. And I'll draw your attention to one book called Can You Catch a Cold by Daniel Roydus, where he presents over 100 studies of contagion. And these are all with colds and flu, not with the stomach bug that you talked about, but we can talk about that too. And in these studies, what they did is they took the snot from people who are sick with colds and flu, even the Spanish flu, and they took other body fluids besides that, and they gave it to healthy subjects. And many of these studies actually were controlled, where they gave the snot to some subjects and they gave just saline to other subjects. And what they found in over 100 studies is that they couldn't make people sick this way. Even with the Spanish flu, with other flus, with colds. And so this body of research has completely disproven the theory of contagion, which says that we pass germs from one person to another. So there has to be another explanation. And with colds and flu, There's one very simple alternative explanation, although we could think of many others. And that would be that it is a seasonal effect or a cyclical effect. And we already kind of know this because we even call it cold and flu season. And that's because people get down with these illnesses at the same time based on changes in the environment, specifically the humidity dropping down. And we know from other experiments that the mechanisms that your airway uses to clear out debris that we breathe in, like particles and stuff that are in the air, shuts down when the humidity drops even just a small amount. And so this now, all the air pollution that we're breathing in accumulates, and the body has to purge it out some way, and that could be why we get colds and flu. So when we talk about a stomach flu, or a gastroenteritis is the medical term for that, acute gastroenteritis, well, there could be many other explanations also based on environmental exposure. Like people in the same area might be exposed to the same air quality and air pollution, for example. They could be exposed to the same geoengineering materials. They could be exposed to the same food supply. They shop at the same grocery stores or the same restaurants. And we've seen, many examples of this for like when a certain food item at a store is contaminated with either fecal runoff or with chemical runoff, which occurs frequently in modern agricultural practices. And then there's an outbreak of gastroenteritis. Well, it could easily be from eating the fecal material, which contains the poisonous waste products of the animal, and the chemical runoff from, for example, chlorinated pesticides, which are widely used in agriculture and then get into the water supply, and they could easily enter the foods. I mean, they do enter the food supply, but they could contaminate at much higher levels when certain things happen. So we have, potential alternate explanations for many of these things. And in fact, even if you go to the Mayo Clinic, you'll see that there are a whole bunch of chemicals that also are known to cause acute gastroenteritis. And they include some of the things I mentioned, but also heavy metals, which we're exposed to from many different sources in the environment. So we have, alternative explanations with scientific evidence behind them, whereas in the area of contagion and germ theory, scientific studies have all failed to demonstrate that causal relationship. It's just that people are ignorant to those studies and their results, and they're instead programmed to believe in contagion and germ theory.
Yeah, I think it is. It could be more like placebo effect, because I remember when I didn't have my own kids and I was working in a kindergarten, and whatever those kids around me got, I never got it. I never, because I really didn't care.
And that's the same thing that happens with the emergency department staff. They have patients come in by the dozens with the flu, and they don't get the flu.
And some of my colleagues, they were like, "Oh my God, I will definitely get it as well," and they did it. And I can feel really that now, like recent years, I have been more like, "Oh my God, did they have this stomach flu? Oh, that means that we're gonna have it as well." So probably it's, in our case, it's more like this, like mental, psychological thing. Because also when you were mentioning the flu season and stuff, what I have been able to observe is I am doing this. I think it is kind of Indian practice that you rinse your nose with a salt water.
So
I'm doing this every morning, and for years I think I haven't never, even if I get some runny nose, it is like really mild, and I cannot even remember having flu or something like this. Uh, and I have been telling my family, like, you should start doing this, guys. What do you
Right.
think
Well, I
about
mean,
that?
I agree that neti pots can definitely be useful, but you can't really prove that it's the neti pot is the reason why you haven't gotten sick. It could be many other things.
Yeah, and what I have been able also to observe in my case is that I am getting sick when I don't sleep well for several nights, or that I have been under high pressure of stress. Then I kind of get ill immediately.
Hmm.
But when we like talk about this, that our inner and outside of us, the environment is the reason or the cause why we the balance and we experience different symptoms that doesn't feel so nice.
I've definitely found that to be true. That detoxification is really key, and I found this out kind of a little bit by accident because several years ago, maybe about 2018 or so, 2017, I read a book which suggested to do an elimination diet. And I tried this with someone else who was struggling with some anxiety issues. And we both had amazing results in terms of health improvement. And I continued to, from then, I was inspired to find any, alternative or natural healing expert that had good results. And, but they needed to prove that. There needed to be hundreds of testimonials or other evidence that they were very successful. And I began studying their work. And over time, I started to realize that they all had one thing in common, all of their methods, and they all involved enhancing the body's detoxification methods. And this can be done several ways, and your body does it naturally on its own. And these methods and materials are really only to facilitate what your body's actions are. And this led me to research, well, if detoxification is so successful, then we must be poisoned. And I started looking for evidence of us containing various poisons in the body. And I found just an overwhelming volume of evidence that, even directly from body fluids and tissues, that we can find just dozens and dozens of very harmful substances. And there are many, many more that we're exposed to that no one has specifically looked for yet. So putting all of this together, I came up with my own hypothesis, or you could call it a theory, but that it is essentially man-made chemical poisons that are largely causing a lot of the modern illness.
And do you believe that this detoxification process should be like done daily, or is it like, I don't know, several times a year, or how do you think it's best to do it?
Well, it's going to depend on, an individual and where your starting point is, because if you've never really done anything like this and you've followed the standard American diet and lifestyle up to this point in your life, you probably need to do a major detox protocol to kind of reset your health, and that, being the first step. But once you're in a good state of health, in order to maintain yourself, I mean, one of the critical aspects is to limit the exposure of these things. So to live a healthy lifestyle, to be cognizant of where the risks are and make some changes. And many of these things are quite simple and don't involve any sacrifice, like, for example, just using different cleaners to clean your home can make a big difference. But you still can't control everything because you breathe the air pollution, that's out there, right? Things may contaminate the things you buy, even though you have a really high effort to be clean. Like even organic food, for example, has been shown in studies to contain some of the same pesticides and herbicides that's in non-organic food. So we can't fully control this. So it's incumbent upon us to do some kind of periodic detoxification. And I think it's an intermittent practice, but it depends on the individual. And we can look at ancient cultures and find that, ancient cultures and religions often had this built in to their cultural practices. And this would be things like fasts, ritualistic fasts, because fasting is a process, and this is, what all animals really do in nature when they're sick or injured, is to stop eating for a period of time. And that allows your body to go into a detoxification and healing, like repair, rebuild mode. And so in many cultures, there is a traditional fasting time in the spring. And so just doing, one fast a year may be enough to maintain your health if you have a very, very clean lifestyle. But you can do this more often. You could do it, each quarter, for example, or you could even, fast for one day a week. Every Sunday you fast for 24 hours. That would certainly, not affect your health only in positive ways. And some people do other things like coffee enemas is a very effective and popular detox procedure. And there are many people who, do coffee enemas every weekend, or every few months they do, for a week, they do coffee enemas on a daily basis. So there are many, many ways you can achieve this in a sort of a maintenance mode once you attain a good level of health.
So, and are you still offering a detoxification protocol?
Yeah, well,
On your own.
I mainly consider myself an educator, and I have several workshops and courses on various aspects of addressing your health, and they almost all involve some form of detoxification. So this is something I think is very important, and many hundreds of people that I've worked with have had tremendous results using these methods. And I didn't come up with any of these things completely on my own. There's a lot of knowledge already out there, and what I've done is I've studied that knowledge. I've gotten experience with it with myself and family, as well as clients, and learned as much as I can to refine these things over time and learn, what method is the best for, which individual and for which situation. And so that's how I teach it.
And if we come a little bit back to illnesses, as we would call it, can we look at it also in a way as body's technique to detoxificate itself, like with a fever, with throwing up, with all those signs, with all those processes that are happening?
Yeah, absolutely. Many of the symptoms of, acute illness especially are obviously our body's attempt to detox, right? I mean, if we're throwing up, what's happening? Our body is getting rid of something, right? Now, our body has the wisdom to only get rid of things that shouldn't stay. And, we have, of course, a routine way to do this when we're healthy, right? We urinate, we defecate, we sweat, we exhale, all those things. Even if we don't, have a runny nose, all of those mechanisms get stuff out of the body, right? And we know they're waste products. Nobody wants to go near feces because it's nasty, right? It's nasty because that's what the body's getting rid of, the nasty stuff. And so when we have the symptoms that you mentioned, right, like a runny nose, vomiting, diarrhea, our body is getting rid of more stuff, right? And getting rid of it in some ways that are different from the routine ways often. I mean, I think about diarrhea as it's like our body's internal pressure washing mechanism. You know, it's getting the dirt and muck out of there, right? Which may have built up or we were exposed to under some unique circumstances. And fever is a very similar thing because one, the high temperature of the fever can denature various chemicals and render them less toxic. And this is, you know, especially true with things like protein toxins, but other chemicals as well. And then the sweating, obviously, and the vasodilation of the blood vessels in the skin required for that delivers the things in the blood right to the skin to exit the body. And we know from scientific studies on sweating that we can find lots of toxic chemicals in sweat, including heavy metals, BPA and other bisphenols, and other plasticizing chemicals, and flame retardants, etc., can come out in the sweat.
So basically, for example, I am originally from Latvia, and there from the ancient times, there have been like every week, the whole family were going to the sweat lodge. So basically, it was also kind of a weekly detoxification, right?
Yeah, absolutely. That's a great example.
Okay.
I'm sure we could think of even more cultural practices that fit this criteria.
And so, because one of the things also, you know, especially if diarrhea and vomiting or the fever is like lasting for many days, and people get stressed, especially if those are kids that are, you know, having this.
Yes.
What is actually the best way to help our body to deal with this?
Yeah, so that's a good question. And this is something that I actually have a free masterclass on. It's called Avoiding the Emergency Department, which you could find it on my website. But because with fevers, especially in children, you're right, there is a fear that parents have that the fever can get too high, that they could have seizures or other problems. And, you know, it's important to have the knowledge of how to deal with this situation, of course, and when to worry that it's dangerous and is it even dangerous. And so there are several aspects to look there. You know, one is what's the temperature threshold, you know, for a high fever that you should worry about. And it's really when it gets above 104 degrees Fahrenheit is when there is a risk of having febrile seizures. Now, adults almost never get their temperatures up this high, but it can happen in children. So the important thing is not to try to suppress the fever with drugs. And that actually even can cause serious complications like Ray's syndrome, which can cause liver failure from taking aspirin with a fever. So be very careful. And those drugs are anti-inflammatory drugs and fever-reducing drugs are all toxic substances. But there are things you can do if the fever is getting really high and you're concerned about it. And one is simply doing water enemas. And this provides an alternative pathway for your body to detoxify so it doesn't need to mount as strong of a fever. And you can do this even with children. And there are lots of instructional videos you can find out there to tell you, you know, the technique and what equipment. But you can also do a bath. It doesn't have to be even an ice bath. It shouldn't be hot. It could be cool or even cold. And if you put a adsorbent substance in the bath water, like Epsom salts or bentonite clay, that will help the body detoxify through the skin, which it's doing already. And therefore, you know, alleviating the need of the body to mount such a high fever. Now, if your child does have a seizure from a high fever, the only danger of that is that they might injure themselves while their body's shaking. So you want to make sure that you put them in a recovery position, that you supervise their safety until it stops. And it should last only a short time. Usually these things just last a matter of seconds. And then know that when you have seizures from a fever in a child, it does not result in brain damage. It does not result in any cognitive deficits or learning disabilities. In fact, you could not tell a child who had a febrile seizure versus one who didn't in any type of observation. So it's different from epilepsy, and it is scary, of course, to witness that. And there is that risk that they could, bite their tongue or bang some part of their body and injure it. But aside from that, there are no long-term complications or effects, so you can just breathe a sigh of relief about that. And that's well documented in the mainstream scientific literature. It's not, it's not it's a regular mainstream opinion.
And despite of that, the first thing, at least in my experience, what people or the medical personnel is doing at the emergency room, or like just coming to them, with some kind of severe thing, they are they are trying to get the fever down. They are doing lots of like weird things. And I remember when our son was like 2 years old, and he had this I don't know how it's called in English, but when you have like this kind of this
stridor or croup.
Yeah, but also like this cough that is like really dry, and then yeah, we were sent to the hospital, and the doctors, they were doing really lots of weird things and using, even among themselves, they were not on the same page, and we were kept in the hospital. And to me, as a mother, it was almost impossible to understand what they are actually doing, because there was no explanation why exactly this and what are the options and stuff. So the only thing probably that I learned from that situation was, okay, we should never get into the hospital.
Well, that childhood illness, can be scary. And I think what you're talking about is what we call in the U.S. is croup. And of course, it's said to be caused by a virus. But this is when the child has swelling and an obstruction in their upper airway, like in their throat. And they make these loud breathing noises, sounds kind of like honking. And they're obviously can be in distress. And you can tell, if the child is working hard to breathe and they're in distress, that definitely is more concerning. Now, most of the time, just by a steam shower, like you go in the bathroom, put on the shower as hot as it goes, close the door, let the room fill up with steam, and just by breathing that steam, usually it calms it down. But I do have a way to address this, but if I mention what it is, then this video will be censored from YouTube if you plan to put it there. But it is included. It's included in my How to Avoid the Emergency Department masterclass, because you get a PDF which gives you the protocols for dealing with these common emergencies, including these kind of breathing emergencies like bronchitis and pneumonia, as well as, gastroenteritis, febrile seizures, poisoning, and bleeding, and a few other things. So if you go to my website, you can definitely get the procedure to do. And I've done this with my own child when he was an infant, actually, because he had this condition one time and it was not responding to the steam shower. And we did this other procedure, and within 3 minutes, it was, I did not expect such brisk results, but he just was breathing completely normally. So it's a very powerful procedure, probably why I can't mention it here.
Yes, but what we could talk about is what's going to be your talk on the coming NonConformist series.
Oh, well, yes, definitely. And, because of the theme of this series, I wanted to kind of interface the medical and the legal system. So I'll be talking about if, the horrible situation arises where you have to go, excuse me, to a hospital or urgent care center, how can you make sure to protect your rights when you're in that facility? In other words, how to make sure they don't start injecting you with things you don't want, running tests you don't want, giving you medicines you don't want. Just get the service you need and want. And also, how do you avoid going bankrupt and having debt collectors call you as a result of the crazy bills that they might send you after that visit?
That's really, really exciting theme and very actual for, I think, all of us, because we never know, what happens even in a few hours. Some kind of really big accident can happen. And also, while thinking about our daily health, we have a time to think, we have a time to do our research and talk to several practitioners or someone that we trust, and then decide what we're going to do. But even, when that I learned some weeks ago, that even when I go to, for example, to just take a simple blood test, and suddenly I'm informed, oh yeah, but there is a new test, and we're going to inject your kid with this medicine and check it out how it reacts. And I'm like, okay, what is this medicine? And of course, I'm aware that I cannot even, if I ask, can it cause some side effects that can be really severe, and of course those medical and people, even I don't think that they are even aware that several things, like for example vaccines, if I ask them, can they cause any complications, they will answer, oh yeah, sometimes you can get some fever or something, and you can get red around the place where the injection has been done. But I cannot a way that they're gonna inform me with the full information that I can actually make this consent decision. So yes, and to know how to react, and especially when it's really stressful situation and we have no idea what to do, and we have no idea what even on the name procedure or the thing that they want to use on our loved ones that even mean.
Yeah, well, you bring up some really good points, and you're right. You should definitely not rely on any healthcare professional to tell you about the risks and benefits of a medication or a procedure, because most likely they won't actually know. And so they won't be able to give you the complete, information. For example, antidepressants, like modern antidepressants, like SSRIs, they have been shown to increase your mortality in 5 years. So you're more likely to die in 5 years when you take antidepressants versus not taking them. But there is no doctor in the world that I know of, there might be one or two, but extremely rare, who will tell you this when you're making a decision if you want to take antidepressants. So it's only up to you to learn that information. But here's the problem: when you check into a hospital, they have you sign a consent form, right, in order to get treatment at the hospital. But people, of course, don't read what they're signing. But in my talk, we read it word for word, so you could see exactly what you're agreeing to. And what you're actually agreeing to is you're giving up your right to make the health care decisions for yourself, and giving strangers at the hospital, your medical team, carte blanche to make their own decisions from their perspective of what they think is required. And this is a huge problem, obviously, because just because you check into a hospital doesn't mean you're suddenly incompetent and can't decide for yourself. And even if you were unconscious, for example, and couldn't decide for yourself, you still can have it. You could decide ahead of time, and you can have documentation and a designated representative who can get that information to the facility on your behalf, or you could even provide it to them ahead of time, for that unfortunate situation. But if you sign that document, you're essentially giving up that right to make your own decisions.
Yeah, that's exactly also what I remember from the experience that I mentioned, that I was given to sign agreement that whatever they do, I agree to that. And it was basic, at least I had the feeling like, okay, either I sign it or either we leave without any consultation either, because then they are like, okay, then if you don't agree to this, then we cannot do anything. And then you are on your own. And that can be a really stressful feeling,
Well, that could be the best thing they could do for you, because then they won't have the opportunity to harm you. But of course, if it's a life-threatening, urgent situation, they're not allowed to turn you away. At least not in the United States. There are laws against that. Mm-hmm. And plus, if you called up the local news and told them about that, that would, definitely be a newsworthy type of story, and they don't want bad publicity. But I'm not, for contracts, one of the things that I talk about is contract law, because this form that you sign, or that they're asking you to sign, is a contract, right? It's an agreement between two parties, you and the healthcare facility, to exchange, value, right? They're providing you with healthcare services, you're providing them with money, whether it be directly from you or from third-party insurance. That's what's going on. So it's a legal contract, and you have the right to negotiate the terms of a contract. You can't be forced to enter into a contract. And so you can actually change the writing on the form. You can cross things out and write in other things. Now, they may not agree to it, but nevertheless, you have that right. And, I know from experience, at least in the United States, that they're going to still provide treatment, because they're afraid of being sued. And if they violate, the federal law where they're required to take care of someone in an emergency, they're not going to risk that. They're going to be very careful actually dealing with you, provided you do it correctly.
It is always good to know our rights and what we actually are allowed to do, because if we know it, and even if we don't express that we know it, but we just have it in our energy, then they at least not gonna start, shame you and blame you. And as it has happened with some, for example, one family in Latvia, that their kids got diagnosed with what do you pronounce it, diphtheria? Mm-hmm. That is, and when they were questioning the treatments and stuff, the medical personnel, they got so psychologically abusive and threatening and shaming the parents and stressing them out really awfully. But when one is in that situation and hasn't experienced it before and doesn't know the rights or the possibilities that have been done, it can be really, really stressful and awful situation. So our time of the conversation is coming to an end. So please, could you share, so you mentioned your homepage, could you share like all the links and where we can see you, reach out to you,
Absolutely. The best place to go is andrewkaufmanmd.com, where you can sign up for my newsletter and then be informed about all my new offerings coming out, because I am going to be delivering my core terrain workshops this summer, and I think that would certainly interest people. The first one scheduled is called The Way of Water, which is all about hydration and water. And I'm going to answer all those questions that come up over and over again about water. So you may want to look out for that. And also, I sell the highest quality Shilajit available at medauthentica.com, which is my shop website. And of course, you can find me on all the major platforms. I'm heavily censored on YouTube, but there's still content there. And certainly I have a lot on Instagram, Facebook, X, Rumble, and Odyssey and BitChute. So please check out my material and sign up for my newsletter. I'd love to welcome you into my community.
And I'm going to put links in the descriptions of the video as well. So yes, stay tuned. Check out those web pages. Check out the NonConformist Series with very important topics discussed there. And thank you for your time, and peace, love, and anarchy, guys. See you next time. Thank you.